Greetings and a warm welcome to everyone joining us from the various concerns of the digital relay. Today, we are going to discuss about the topic the effect of diversification and discrimination in professionals in healthcare services. Let me introduce the speaker of the day, Ms. Bassey Grace. She is here to present here today. She is a public health specialist. So over to you, Ms. Bassey.
Okay, thank you very much. This is Nigerian time. I have to say good morning to you all, and I want to also thank you for granting me this opportunity to be one of your presenters. And my topic, as you've seen earlier, is the effect of diversification and discrimination amongst professionals in healthcare services. So before I continue with my presentation, this is the outline. We are going to introduce a topic. We'll talk about the objective of the presentation, the functionaries of healthcare professionals, discrimination and diversity amongst professionals, relevance of diverse and representative healthcare workforce, health professionals, representation, then conclusion, and then I will give few recommendations to avoid future occurrences. Thank you. So a brief introduction. What do I mean by discrimination and then diversification? Discrimination consists of actions against a group of people, and this can be based on either the race, ethnicity, the age, the religion, the health sectors, and also other categories. And then this is also a preformed negative judgment or attitude. Diversity is broadly defined as the inclusion of varied attributes or characteristics. And then healthcare refers to the effort that medical professionals make to restore our physical and mental well-being. And then the term also includes the provision of services to maintain emotional well-being. We call people and organizations that provide these services healthcare providers. You can equally call them healthcare workers or healthcare professionals, or better still, health professionals. So the introduction continues. The term also applies to the organized provision of medical care to humans or a community. Healthcare is also the maintenance or improvement of health via the prevention and diagnosis. You can see diagnosis comes in here. You see where all the professionals has to work together, the doctors, the nurses, medical lab scientists, and the rest of them. And treatment of disease, illness, injury, other physical and mental impairments in human beings. Diverse, and for this to occur, we need all the professionals to work in unity. And that is why I bring up this topic. And diverse and representative healthcare workforce improves patients' access to care, their perceptions of the care they receive, and their health outcomes, especially for patients of color. The evidence from this review showed that underrepresented minority health professionals, particularly physicians, serve minority and other medical underserved populations disproportionately. That minority patients tend to receive better interpersonal care from practitioners, despite their various races. So I want to also highlight us on the objective of this presentation. Why did I really, go into all this? And before I read out the objectives, sometimes I see health professionals, going on strike as a result of one irrelevant excuses or the other. And at the end, who suffers? Is the patients that suffers, because they'll be left in the world, to die because of no treatment or no adequate attention. So now I'll be defining some of the terms: diversity, discrimination, and also I'll be discussing their implications in healthcare. And I will also address professional rivalries, and I'll show us the varying the health professionals we have in various health centers, and also how they affect the healthcare industry, and also outline actions the healthcare system can take, or government, can take to increase diversity and reduce disparities. So these are the functionaries of healthcare professionals, and I'll include three groups. I'll be expatiating on them much more later, but you can see primary care, secondary care, tertiary care. Under the primary care, you can see the first point of contact is the GPs, that is general practitioners. You see, so when the general practitioners go on strike, what happens to the patient? You know, so, and also we have nurses. At the primary care level, we have dentists, also work in primary care. In the secondary care, we include specialists such as neurologists and the rest of them, oncologists, gynecologists, and so on. And then we also have tertiary care. We have hospitalized patients, and those undergoing operations are in tertiary care. And who takes care of them at this level? That are the nurses. The nurses, the doctors, and even the medical lab scientists, and the rest of them, you see. So this is an organized provision of medical care to individuals or a community. So other functionaries are the act. What is it really about? The act of taking preventative or necessary medical procedures to improve a person's well-being. These are three main types of healthcare, like I earlier discussed. We have the primary care I talked about, the secondary care, tertiary care. The primary care, let me go in a little. Primary care is the first point of contact for the majority of people. For example, like I mentioned, the GPs, that's the general practitioners, the dentists, and community pharmacists also work in primary care. I've defined the GPs. We also have medical lab scientists. We have environmental officers. Even here, we also have even the cleaners and the like. We also refer to general practitioners as family physicians or primary care physicians. Nurses, practitioners, and some other types of nurses are also under this primary care. So we continue to talk about the primary care physicians. What are they? They are uniquely positioned to go beyond the immediate needs of their patients. Everything from writing a prescription to examining the larger, more daunting socioeconomic and environmental factors that affect their patients' health and well-being falls within their scope of work. So doctors cannot say it is only them and them alone. The nurses say, medical lab science, them, they have to work in collaboration as a team for it to work. So we also have the secondary care. After a patient have seen a primary care provider, like I said earlier, the GPs, the nurses, and so on, they may then see a secondary care professional. This person may be a specialist. For example, if you suffer from a mild chest pain, you may first see your GP. The GP may then refer you to a cardiologist. The cardiologist works in secondary care. We also have the psychiatrists. We also have the anestheticians and the rest of them. So under tertiary care, let's suppose the cardiologist decides that the patient with mild chest pains needs heart surgery. Who does that? The operation will take place in a hospital, quite all right, but a team will have to be involved. Unfortunately, today, because of maybe money and so on, you see some doctors creating a small cubicle. They will be the general practitioners. They are the everything expatriates. They are the nurses. They are the medical lab scientists, and it's not supposed to be so. Others has to be involved, because before even the surgery takes place, the anestheticians has to be called to do what? To inject the patients. But today, you see the doctors even carrying out their own functions, and this is not good enough. The patient will be hospitalized. The operation and hospital form part of the tertiary care. The anestheticians comes in here. According to Dumfries and Gallo Advocacy Services, I don't know if we have really heard about these people. Thank God for the Dumfries What do? They stand in the gap. What else do? They make sure that they stand in for the rights of every organizations and even for the rights of patients. So that is what they do. So also we have tertiary care requires professionals, usually the surgeons with specific expertise in a given field, to carry out investigation and treatment for the patients. Examples include neurosurgery, cardiac surgery, and cancer management. Can just a medical and a doctor take care of all this? No, they have to work as a team. That is why Dumfries comes in. Dumfries and Galloway Advocacy Service works on behalf of individuals in Dumfries and Galloway to speak up and promote rights when assessing national health services as well as local health services. So I will give us a little task to undergo. These are the directions. It is shown below. Shown below are few examples of health professionals. Choose one from among the health professions below that interests you. Give 2 to 3 descriptions about it and cite 1 to 2 reasons for choosing this career. Use a table as your guide in answering this activity and write it in a separate sheet of paper. I think I would like each and every one of us to do this. You can see we have the doctors, you have the paramedic, we have the nurse, we have the surgeon, we have the pharmacist. They all work together. These are all representatives of the medical professionals. The doctors, the nurses, the environmental officers, and the rest of them, the dentists, all of them, gynecologists, they're all represented here. Nobody can work alone. These are the example of a medical team. You can see the doctor there. The nurse is there. Gynecologist is there. General practitioner is there. Medical lab scientist is there. The chief recording officer is there. And this is what we need in our health facilities for it to work appropriately. So now I want to talk briefly on discrimination and diversity amongst professionals. Discrimination in the healthcare setting can be defined as negative actions or lack of consideration given to an individual or group that occurs because of a preconceived and unjustified opinion. A doctor, I can remember when I was the head of lab in one of the hospitals, a doctor walked in and wanted to look at my slide. I said, no. You have your own work. I have my own work. You have asked me to do some work for you. I will do it and give you results. You don't have any right to look at my slide. You can come into the laboratory to look at the register, yes, to see the results if I'm not around, fine. But for you to look at my slides, no. You cannot start doing malaria or doing wider reaction or doing all the microfilariae. No. You have your own work. You have to sit in your office and tell us what tests to run. We all work together. It is worth noting that individuals do not need to be members of an unfairly treated group to experience discrimination against that group. Discrimination can occur based upon perceived membership. And another thing is that, a doctor sits down, a pathologist is being asked to sign the result of the test I did. No, it doesn't work like that. You can't sign my result. You can sign your prescriptions. You can sign whatever your diagnosis and so on. But when it comes to my lab, I sign my result because I carried out the test and I have to sign it. Situation most of the time degenerate to rivalry between the nurses, doctors, medical lab scientists, and other medical professionals. Some doctors believe that they are the head of the world, head of every department, and head of everywhere. It shouldn't be so. If you find others competent, put them there as head. Whoever is competent, whether it's the nurses, matrons, and so medical lab scientists, and are competent, please put them there. It must not be until he's a medical doctor. I think this is wrong. So we have to wake up to this and act immediately. So, and also lack of teamwork. Lack of teamwork. Some doctors feel they don't need others. You need others to work. Allowances. They quarrel over allowances. Every time you will see them going on strike. Why? Because of allowances. Meanwhile, they are highly paid. And then lack of respect. They just walk into any lab, you know, they bypass the head and say, where is my result? It shouldn't be so. You have to respect everybody according to their professions and their positions, you know. Desperate entry level. And you know, for example, maybe even that doctor was not even qualified, but as a result of their power attorney or you had somebody up there, they put you in there as a medical doctor. You know, that is wrong. And also, this should be taught in schools so that everybody will see that they all have their own functions and roles to play in healthcare system. And lack of collaborative training at undergraduate level also have significant role in promoting conflict in the healthcare sector. What kind of trainings are we getting nowadays? Has more than half of these study participants indicated each of them has sources of conflict in the sector. For example, you hear that some doctors left forceps in the stomach or womb of the patient. Why? Because maybe he carried out the surgery in his own little office, and that is wrong. But when the health teams are represented, at least they'll be able to see that. Thank you. So then I want to talk about the relevance of diverse and representative healthcare workforce. Research shows that a diverse and representative healthcare workforce improves patients' access to care, their perceptions of the care they receive, and their health outcomes, especially for patients of color. Discrimination against minority groups persists and contributes to negative disparity outcomes for patients and healthcare professionals. This shouldn't be so at all. Healthcare professionals have a responsibility to address inequity in the medical system. This activity defines the terms diversity and discrimination and highlights the interprofessional team role in improving care for patients from diverse backgrounds. I can remember there was a patient who came in, you know, for us to collect blood. A doctor came in to collect the blood because the patient is fat, thinking that I might not be able to bleed the patient. But no, I was trained to do that. You stay in your own office and carry out your own work and your function. So this is a typical health professionals representation. You can see in all this, there is just nurses, doctors, maybe environmental officers. I have not really seen medical lab scientists there. And this is what brings about rivalry. So, and this is the right teamwork. The doctor, you are doing your prescription. You can also, you see the results from the lab. You can, because we are the eye of the doctors. For example, you ask for a full blood count, and then we are working. We see something else apart from the full blood count. You did not request for malaria parasite, and we see malaria parasites. What do you think we should do? We are your eye. You come to the lab, we can discuss. I can tell you, you know, while doing a differential count, I saw this. This was what I saw. You know, I saw malaria parasite, and it's even 2 pluses. You know, we put heads together and work. Patient walks into a facility. A patient should be able to receive all the care he or she came for. For example, the doctor sees the patient and then gives prescription papers for tests. In the same facility, there is a laboratory. She goes to a laboratorian to carry out some tests. Test result is ready. Oh, the patient needs surgery. The patient does not need to go to elsewhere. The necessary first aid, everything is in that facility. And then drugs are being prescribed, and there are drugs there. And this is a complete setup. This is what we should have in the health sectors. So where there is no rivalry, the doctors work together, the nurses work together, medical lab scientists work together. She discovers, as I said earlier, some things and runs to the doctor. She should be free to go into the doctor's office to suggest, but some doctors may not like that suggestion, and this is wrong. So you can see them working in collaboration. They are putting heads together to be able to solve that particular problem at that particular point in time. The patient needs attention. The patient needs thorough check, you see. So, in conclusion, a person who experiences discrimination may lose all confidence and self-worth, feeling unworthy. When a doctor queries my result, I am a fellow of the Medical Lab Council of Nigeria. I am a doctor of public health, and I have gone far academically. A doctor walks into my lab to do or to query my results. What do we do? How do you think I will feel? You think I can work with that doctor? No. Also, a person's health and well-being may be negatively impacted, of course. They may withdraw and isolate themselves in an attempt to escape the circumstance or out of fear of experiencing a further prejudice or cruel treatment. It is hypothesized that an inverse relationship exists between discrimination and diversity. It has been a prevailing thought within the medical community that discrimination will decrease, equity, decrease and equity would increase if the percentage of underrepresented minorities is not, ironed out and tackled. So while an increase in diversity may not eliminate all problems related to healthcare disparities and discrimination, we strongly encourage healthcare systems to take steps to promote diversity amongst providers. A larger talent pool that includes providers with heterogeneous customs, experiences, and problem-solving tactics can create more innovative approaches to systems-based problems. Evidence suggests that although diversity is a goal, unto itself, diversity alone does not create equity. More than half the pediatricians and gynecologists in the United States are now female, yet department leaders remain predominantly male. Men are more likely to be selected for editorial board membership and achieve status as an associate or full professor, department chair, or medical school dean. Men also earn more at each academic rank. Why? This is what brings rivalry. Please, it has to be stopped because I feel women can equally be heads of departments. They can also chair meetings and so on. So, recommendations to avoid future occurrences: ensure that everyone has fair and equal access to public services such as health, education, and housing of high quality. You see sometimes that the doctors are being given accommodations. Is it only them that needs accommodations? No. The nurses do take calls. Medical lab scientists take calls. So equal houses should be given to them. Or accommodation, befitting accommodation should be spread out and given to them. So this making sure that the planning and provision of all public health sector health services is commensurate with the needs of all represented. These results are similarly found in the nursing profession. The male advantage in nursing has been described as what? A glass escalator, in which men are put on a fast track and almost pushed to achieve positions that include greater responsibility, higher salary, and more organizational benefits. This shouldn't be so, and it should be addressed. Thus, while diversity is necessary and important, it is equity that is needed to decrease disparities and mitigate the impact of discrimination. And also remove financial obstacles from socioeconomically disadvantaged populations. Develop pipeline and mentorship initiatives to boost the proportion of minorities who are underrepresented in the healthcare industry. Yes, somebody asked a question, but the doctors, they studied for 7 years in school. That is why their salaries must increase. Please, we have to look into this, because we also went through that school processes. Choose leaders and committee members with a range of experiences and perspectives by using open and honest procedures. If that medical lab scientist is qualified, to occupy that position, give it to him, or give it to her. If the nurses or matron, give it to them. Provide objective steps for promotion and compensation, increases that are freely accessible, along with pay transparency. So this is teamwork. You can see the dentists, the doctors are working, The physiotherapists are equally working, the nurses, and so on, opticians, and the rest of them. You work as a team to improve on the health sector. So this is a typical health professionals support. You can see all well represented. A teamwork is what makes a good, health sector. These are my few references, just in case you want to go through them. And then, thank you for listening. Thank you. Thank you for listening.
Any other queries from the attendee side? You can raise your hand and ask your questions.
Okay, from the chat box, sorry, I can see some questions. I'm just wondering if this presentation is against doctors. Oh, sorry, I am not against doctors at all. I even have children that are doctors, Are doctors the only one who disseminates? Oh, no, please don't think like that. Okay, let me finish reading the question. I think this presentation should be balanced because the presenter is already discriminating against the doctors. Please, so sorry, I'm not discriminating against the doctors. I am only saying that we should work, as a team, for the better or for the benefit of the patient. That is all. Thank you very much. I hope I am being pardoned. I am not discriminating, please. I'm not pointing at the doctors. Thank you. Okay. So I look at other. I hope I've answered that question.
All right. So, hello. Am I permitted to speak now?
Oh, please go ahead. Thank you.
So, thank you for the presentation. I was actually the one that typed in those, and you have answered. It's just that maybe going forward, subsequently, you can balance the slide and also cite some examples where doctors were actually victims or nurses were victims. Let me give you an instance. We have had situations whereby some lab scientists too, they've taken over the responsibilities of doctors. Some of them go ahead and make prescriptions or try to diagnose patients, and that's not what they were trained to do. Some pharmacists, doctors will make prescriptions. Let me give you an example. Popularly, we use metronidazole as a 3 times daily drug, Flagyl, the popular Flagyl. And here, I'm talking about here in Nigeria, maybe when somebody is having diarrhea or a problem, you needed to use Flagyl, you use it 3 times. However, when it comes to things like peptic ulcer disease with Helicobacter pylori, the teaching is that you use the metronidazole twice a day, that's 12 hourly. But for some reason, when you make such prescriptions, some pharmacists get it and they just revert to the TDS, that's the 3 times daily, without reverting to the doctors who made the prescription. Beyond that, there are other drugs used for multiple purposes. There are some antihypertensive, for example, that you can even use for pruritus, somebody who is having allergy and is itching. Now, these people don't bother to find out why the doctors have made such prescription on their own. They just change the prescriptions. So some of these examples, if we're able to bring them forward, it will really show that it's not discrimination or not applying teamwork is not peculiar to doctors alone. Every member of the medical team is guilty of this problem. And the teaching should be that all of us should come to the awareness and the need for teamwork when we are managing our patient. You're right, a doctor does not have right to come and be looking at your slide. However, we have also received some results from lab that were questionable. And some doctors may not even bother to go check. But some of us will go to the lab and, like you said, we discuss together. And at times they even tell us to send the patient back to them so they can rerun the test. So I think by and large, it's a good presentation. However, going forward, please, let's try to strike balance. Thank you, ma'am.
Okay, thank you very much. Can I add a little to that?
Please, ma'am, go ahead.
Okay, thank you very much. Like you talked about, thank God you gave an example. Okay, for example, you talked about metronidazole and so on. Okay, for diarrhea cases, peptic ulcer, the actual prescription for peptic ulcer and H. pylori. Okay, so it's so unfortunate that I will not say it is not happening in the health sector, so because I think there was a time, I'm not attacking doctors at all. I think something happened. A child came for urine microscopy for medical tests. And while we're examining, I saw that the feet were swollen and the stomach was bloated. And I was just joking with the child while we're doing the test. And I asked, have you been swimming in the river and things like that? The child said, yes, I used to follow my friends when I go to school, to swim. And then I said, okay, with this, and there was blood in the urine, but the child actually came for medical certificate of fitness. So I just picked interest in that child. I decided to run the urine, do the microscopy, and I went to the doctor, and I showed the doctor the result, because schistosoma hematobium, in fact, 2 pluses, so I was a bit scared. The doctor appreciated it. The doctor was happy. He said, oh, some of these food that comes for medical tests, is good for us to go extra mile to really be checking all these things. I was not proving to be too or knowing more than the doctor. No, because we work as a team. And like you said, like this metronidazole, some people don't know the effect of it. Maybe it was 400 milligram or 200 milligram. For like 400 milligrams, we taking one thrice daily. And I'm sure the pharmacists did not really check. Maybe if the pharmacists had really checked the milligram, it would have helped us. I know of a patient that came to me one day and said, the pharmacy gave her this. To take 400 milligram twice, then 2-3 times daily, that was dangerous. I had to stop that patient from going to that pharmacy. It happens, but I don't really know how we can address this, because in some pharmacies, it's not all pharmacies you can really see doctors being represented. But I hope that at least from these lessons and from schools to all these discrepancies will be addressed. So thank you very much for that question. Over.
So Mary, you can ask your question.
Okay, thank you very much. Are you hearing me?
Yes.
Yes, I'm hearing, please.
Okay, well, mine is, I don't know whether it's a question. I want to thank the presenter. You did very well. And also, you have also corrected yourself. Let it not be one-sided, okay? You need to balance it. But then, it's like all the profession, they are very guilty of this. You see, I've heard of a nurse who perform what do you call it, an abortion. I've heard of a nurse doing that. I've also heard of you go to a pharmacy. The pharmacy is a pharmacist and doctor and everything at the same time. And I think many of us, we are guilty. We go to, we do some tests. We are more or less forcing the lab attendant to prescribe some drugs for us, And then it's like some of them, they don't have any choice, but they just tell us, okay, go and take these antibiotics and that for you to get well. I see that happening. And but you see, when you go downtown, you go to villages. When you go to villages, you see the community nurse, or is that what they call the other community nurse, or whatever you call them?
Yes, yeah, Chew and the rest of them, yes.
Okay,
Community health workers and so on.
In
yeah.
some of those health centers, there is no doctor at all. There is no medical lab at all. So the attendant there is a medical doctor, is a nurse, is a lab scientist, is everything. Okay, it's everything. So that person does everything when you get to the village, because in those villages, doctors don't go there. Why? Because of the pay, the take-home pay is not there. So you see a nurse performing all the function. Okay, and then she also talk about when it comes to remuneration. We've seen on TV here in Nigeria where the medical lab scientists are going on strike. Why? Because the government decided to pay hazard allowance to doctors, uniform allowance to doctors, all the various allowances to doctors. And then the medical lab scientists are handling very dangerous specimens. I'm not a medical lab scientist, but you see them, you see that they are not carried along when it comes to all these allowances. Some of them will carry blood which could be contaminated, which could have HIV or whatever and all. They, in fact, to me, they need more of these allowances than the doctor. The doctor only look at books. Majority of them, they only look at books, except those who are in the surgery department and things like that. So what I'm saying that there is no way a doctor will work and you don't need a nurse, you don't need a medical lab scientist, So there must be, it's like a teamwork. Like she mentioned something about where something was forgotten in somebody's stomach. And I always wonder, how will that happen? At the end of the surgery, I'm thinking that somebody who is in charge of the equipment should be able to count how many equipment did you bring in and how many did you use, what is left. You should be able to count all and be able to know, is there anyone missing? So how is it that somebody will forget that or forget cotton wool? Is the doctor carrying out this assignment alone? So I always wonder, because this kind of thing happening shouldn't be a mistake or an error. That person should be sanctioned immediately. Okay, so I want to say that thank God that the other person was able to balance it, that the discrimination, I mean, what our sister just presented should be balanced. I don't think she was being biased. It's just that she mentioned few examples of where she has corrected herself, and that every one of them is guilty. The doctor is guilty, the nurse is guilty, the medical lab scientist is very guilty. Sometimes when I go to the medical lab scientist, sometimes I am like forcing them, oh yeah, look, I don't have time to go and see my doctor. What do you think I can take for this ulcer? What do you think I can take for this malaria? And just immediately they prescribe this.
Okay, hello, sorry, I think it should be network. Are you hearing me? I think I can say something about that. So thank you very much, Dr. Adeshina. So actually, there is a program ongoing for 2 years now, like last year, when the Primary Healthcare Development Agency organized, a program where we had to go from places, state to state, went to Gombe and so on, and Port Harcourt and other places. Like I was in Gombe, we had to do a step down. We started from the national, then from the national went to state, and then from the state we now did a step down training, in Gombe, right down Dema to Yeba, Yema to Deba. We had to go down, to the rural area to teach them, and those working in primary health sectors, so that where there is no doctor, at least they can cope. And when there are emergencies, cases they cannot handle, they can convey or transfer them to the secondary level. So yes, what you have said is right. We are still trying to see what we can do to, to stop all these indiscriminate treatment of patients. So that is, thank God for this National Primary Healthcare Development Agency. The training is still ongoing, but so far so good. We have gone to so many states, government funded states. We have done that. We have done some step down trainings, so, and we are still hoping to do more. And then I've seen a question on the chat from William Tankang. Good morning. Thank you for your presentation. What is the scope of the discrimination? Is this a phenomenon in Nigeria or a worldwide phenomenon? Actually, well, I wouldn't say it is happening in Nigeria alone, but in most cases, we see it happening in Nigeria. Doctors going on strike because of underpayment or because of some allowances or one allowances or the other, and so on. While maybe like the medical lab scientists, I don't want to be biased again, like the medical lab scientists not being paid call duty allowance, or maybe their call duty allowance is not the same as that of that being paid by the doctors, and yet they are doing tedious work, like Dr. Mary Adeshina, stated, so I don't know if I really answered that. And then also Zachariah Kenneth also asked a question. Please, could you share the slides with us? Yes, I think the team will do that. I have sent the presentation to them, so I think your various mentors will get it and then share with you. So you just try and get in touch with your mentor. Thank you very much. Over.
And thank you, Ms. Bassey, for your presentation. It was a wonderful presentation.
Thank you, ma'am. I'm Mrs. Bassey. I was being addressed as Miss. Thank you, ma'am.
Okay. So by this, we will end the session. Attendees, thank you for your patience. A big virtual thanks to everyone for making our webinar a success. Your participation, engagement, and enthusiasm were truly appreciated. And looking forward to connect with you again in the virtual space. So thank you. Thank you, Ms. Bassey. Thank you so much.
Thank you.
Yeah.
Thank you. And thank you, participants. Thank you for your cooperation. And I'm sorry for the bias. Thank you.